And thank you for bearing with me, everyone. As you can see, I cannot multitask. This is our last session of the day. So we hope that you are enjoying Digital Inclusion Week. We hope that your various efforts are going well. We thank you so much for taking the time to join us for our session today. As you can see, we have plenty of CTN folks on the call to monitor the chat. So please ask questions, make your comments there. I'm going to share my screen with you to get us started today. Can you see the screen, the presentation? Thank you,
Yes, we
Ethan.
can.
Thank you. Thank you so much. Our last session of the day, we wanted to focus on what is probably one of the biggest challenges right now. It's a pervasive part of digital inclusion work for all of us. We're calling this Patrons, Patients, and Constituents, Health Equity and Aging. And in the title alone, you could literally have a webinar per word of that title. So this is ambitious. And therefore, I want to put our presentation and our panel really in context for you today. Before I introduce our panelists, I just want to say that these are our goals and this is our approach to this. We want to approach the nuances of the digital navigation role because this is such an ever-evolving thing, just from one session to the next, from one client to the next, from one patron to the next. Digital navigators are becoming the jack of all trades in one of the most important intellectual pursuits of our time, which is to teach people digital skills that are needed to participate in society and to have true autonomy in their lives. And that's asking a lot of digital navigators. And so one of our approaches is to recognize, articulate, and talk about the nuances involved in that role. As you can tell from the title, we would like to focus on two areas, but we don't want to be limited to those two areas. And so please do put questions, comments in the chat, your feedback, your observations in the chat, and we'll try to respond to those, or at least you can keep that conversation going there. Working with aging populations is an important part of the work that digital navigators do. Plus, healthcare concerns for people in general, health equity concerns for demographics and populations in general, as well as those healthcare concerns for the aging populations themselves. Before we jump in, I'd like to make a couple of clarifications. To have this conversation in the short amount of time that we do have, we're making some we're using terms that are very sweeping generalizations, and we don't mean those in an offensive way. So to clarify, we are not saying that aging folks don't have digital skills. Aging folks come from the time when so much of the foundation of our technology globally was invented. So we are not trying to say that older folks are limited in their digital skills or are more limited than anybody else in their digital skills. That is not an assumption we're making. We're also not making the assumption that older folks are the only ones with healthcare issues and healthcare concerns and healthcare inequities. So I realize that with all of the 5 million words that we put in this title, it makes it look like we are combining those things. But really what we're attempting to do is acknowledge the increasing role of the digital navigator in helping these specific issues. People who are aging, people who need access to digital skills in order to access healthcare. And therefore, the terms that we're using are also meant to be general, but are not meant to take away any type of individuality. So we are not using senior, we are not using older, we're aging. Literally all of us on this call right now in the current moment are aging. So we just mean aging populations. After today and having 85 webinars in a row, I feel like I'm aging at a very quick rate. So, no disrespect. With that, let me introduce our panel for today, and let me turn it over to our panel. Here are our perspectives from our panelists today. We have two lead digital navigators with extensive experience in a multitude of environments and diverse populations. We also, one of those digital navigators is pursuing a PhD in public health and has extensive work in public health, both experientially and also academically. So Ethan, who will be introduced in a moment, will also have that perspective as well. Additionally, besides our digital navigators, we have two senior positions here at CTN that will represent other parts of organizations. The first is managers of instructional staff. So on behalf of organizations, we want to represent issues that come up for supervisors, leaders, and managers of instructional staff and digital navigators who work in these types of environments with these concerns that are coming up. And they're not the only ones who do that. Volunteer coordinators do that as well. We recognize that volunteers are an essential part of a lot of digital skills training, but that opens doors to different challenges because they must be trained in the same way, they must take the same precautions, they must be supported, and yet from an organizational standpoint, they're not paid staff and they're not contractually obligated to do the same things that staff are. So we're actually tackling quite a bit today in order to acknowledge the layered factor of health equity, aging populations, and the increasing demands on digital navigators. And with that, I would like to introduce our panel members and then start our conversation today. Our two lead digital navigators are Ethan Baca and Alejandra Alcaraz, who I will refer to as Ale. They are relatively new to CTN. They've been with us for just a few weeks, and we are quite honored and excited to have this level of experience in the navigators that we have. And they'll be talking from their perspective, not only here at CTN, but from their vast backgrounds and education. We have Patrick Hsu, who leads and manages and supervises the instructional staff at CTN. If you're not familiar with CTN, one of the things that we pride ourselves in is our cultural diversity and our multilingual capacities in our curriculum. This means that in addition to the complexities of being a digital navigator, Patrick supervises a staff that speaks multiple languages, are located in different areas, that are called to serve their communities and their demographics, but who are also called to represent CTN's mission and values. That's not easy. And we have Patricia Ju, who I will call Pat. And she is our data quality and control manager. She has her hands quite full managing and controlling our workflow processes and data here, but that's not what she's going to talk about today. She actually started at CTN being our volunteer coordinator, and she developed our program into the robust one that it is today. And so she'll be speaking a lot about how these issues pertain to volunteers. So with that, I would like to stop my screen. And I would like to open up the conversation to our panelists. So Ethan, Ale, Patrick, Pat, anyone, not just in your current position, but in your vast experience, can you talk about your experience or times when you have either had challenges with aging populations or you have been involved in healthcare concerns and these healthcare trends or the privacy issues that go along with those?
Hi, everyone. I can go ahead and answer that question or share an experience that I've worked in. So, I've been working in the digital equity space for, I guess this is now my third year, and I would teach computer fundamental courses at the housing authority or at a health clinic. And so, here we were working with older adult or aging adults and serving them and giving them these very essential tips and instructions and information. And yeah, it was definitely something that to me it came very naturally because I did this with my mom. You know, I did it with her sisters. She has seven sisters, and every one of them is very active on Facebook. And I really like what you said earlier that we're not saying that it's just our aging population that doesn't know how to be on the internet. I'm actually going to share some articles while I was preparing for this. I read a couple of research articles on how the increase of aging adults 65 plus being on the internet and using smartphones has increased very rapidly since 2021. So it's something that is happening. We're all on the internet. My mom is 65 plus, and I would have never. I remember teaching her like you just need to remember your password. Like that was like the one thing that I would just always tell her like just remember the password. But then when I came into this field, I was like, there's so much more to this, right? There's citizenship, there's like safety tips, there's devices, there's preferences on how you use your devices. And so, yeah, that's a little bit of what I experienced.
Yes, I can speak a little bit about that. Before I am the staff, the infrastructure resources manager. I was the bilingual infrastructure as a contractor before, and at that moment, I worked with a lot of Chinese or English at aging adults. Some of because at that moment I joined in CTN in 2020, I think, something like that. And at that moment, it is pandemic period, so we cannot teach our learners in person. So normally we can only do training in virtual or only on phone. And at that time, because many of our people suffer in the pandemic period and they need the healthcare a lot. But because for the especially for the Chinese population, they many of them can only speak in Chinese. They cannot even read English, and they don't know how to surf the net and search for different information, especially for the English information about the healthcare. And so that uh, I have to uh, uh, teach them different kind of skills that which can help them to understand different things about healthcare, like Google Translate, or they have to know how to use Zoom meeting because they had to see the daughter through Zoom meeting. And also because most of our Chinese, they don't use email, so it's hard for them to pay a healthcare account on the internet because they don't have any email account. So I have to give some guidance to them and tell them that is very important for them to create an email account and how to create a password as well. So I feel they got a lot of support at that moment, and they can, yes, some of them, they can even order the testing kits after online. So I think that this is a good experience about that.
Yeah, I can speak a little bit about it. And I have a personal anecdotal story too. As part of the volunteer coordinator, I also was sitting in on tech advice drop-in sessions that were online, and a lot of the questions that came up were around like how to use the online health portals with healthcare providers. So some of them can be very confusing. You can go all sorts of different places in the portals, and some of our participants, we would get lost. What was great to see though was like when we were in those drop-in sessions, we had a group of them. We had people also in our Asian population that was offering advice for their peers. So it was nice to see that they were learning, but there is a lot to learn. And anecdotally, when all the pandemic was happening and all the information was coming at everyone, for many of us, it was easy to go online and check it out. But for the aging population, some of them don't think to go online to look for that information. It was nice to hear that their community of peers or their community in general would give them advice and tell them where to go to get that information. So it is a real question of what to do going forward because all of that information is moving more and more online. And what else can we do on top of just having that information online? How do we share the knowledge of going there and finding that information? That's something that we are working on putting together and sharing that knowledge so everyone can access as many of the tools that are available to everyone.
One of the main issues is lack of trust. I'm in San Antonio, Texas, and I work primarily in one of the poorest zip codes, if not the poorest zip code in the metropolitan area. And that area has been neglected for a very long time by the government. So there was this huge lack of trust where people didn't want to take what city officials were telling them. So one of the things that came from the pandemic and even before the pandemic are community health workers or CHW. These are people that are out in the community that look like the people that they're there to help, that have these relationships. And they play a very big, vital role in helping everybody navigate these issues, whether it's through technology or the main one is applying for benefits. So CHWs play such a huge role in this because not everybody in these communities has access to a cell phone. Or if they do have a cell phone, it's a flip phone. Or they don't have Wi-Fi. Or they don't know how to use the computer. A whole variety of different options. So one of the main issues that I've faced when I was helping out with COVID vaccines was let's get on my cell phone and find out where can we go? What can I help you out with? Where can I take you? Because they would say, I'm going to translate it into English, so it might not make a lot of sense, but they're going to be like, sweetheart, honey, I don't know how to get there. I don't know what is Uber. How can I can't afford these things. So we would use a variety of different resources. We would call our friends that work at other organizations and say, hey, do you have a transportation to help somebody get to their doctor? Do you have a computer lab where I can send them to so that way you can help them do this? Because even if they did have a cell phone, they had an older Android phone that was given to them for free.
Let's talk about the issue of trust, because I feel like it's a biggie. I feel like it's legitimate and important for all populations. For the purpose of this conversation, we'll focus on aging folks, and we'll focus on health concerns. But I'm hearing several things, and so I would like to hear from each of you, even if it's something different than I'm framing it. But I'm hearing Patrick, for example, when you're talking about the Chinese population and you're saying they don't really use email, that's not really a thing. And so in order to ever even get to a health portal, In order to ever even get to a doctor's appointment, we have to first get over the email hump. I'm hearing from Pat the confusion and the sort of mystical nature of navigating health portals. I do not consider myself yet an older person, and it's confusing for me. It's also confusing for me because all of your doctors have different health portals. So just for me personally, and listen, I'm lucky to have doctors. I'm lucky to have insurance. I admit that. But my dentist is one, my health practitioner is one, and that's confusing for me. Ethan, when you talk about, various demographics, and not trusting things, can you each offer advice for digital navigators who find themselves in these situations? Can you otherwise respond to ways to address trust issues? And again, it doesn't have to be framed exactly like I said, but that's just what came to mind about how to increase trust in order to get closer to health equity.
I could jump in again. Yeah, so another article I wanted to share is this is an article from the National Library of Medicine and how there are times where there is a bias or there's ageism. So people can come at like, well, you can't teach an old dog a new trick. Yeah, well, you don't really have to explain that to them because I'll just do it. Their daughter will do it for them. Or, their community health worker will log them in and put the appointment. So the truth of all that is that that's just taking away autonomy from our learners and from our clients, our patrons or patients. And so this article really focuses on how aging people, the article is called Older Adults, can learn technology. And well, this is our field. So yes, we know that they can because we've seen it. There's so many testimonials. You can see it on our website. But something that I know that a lot of us have practiced, I'm sure you guys can relate, is creating that trust is by showing up, and believing in them, not coming with that ageist bias, thinking that they can't learn something new, and then showing them that these tools and these skill sets that we want to share with them, and facilitate the learning process of it all is only going to benefit them in the long run. So health portals, instead of waiting for that phone call to learn about this very important test result, they can look at it way in advance instead of waiting for the phone call. Or there's now medical devices that require you to track with Wi-Fi or on your phone. So making sure that they know that, hey, don't unplug the Wi-Fi. This is why this is so important. Or look at this app. This is how you can track this. And so really coming to a place where you not only are meeting them where they're at, but also treating each other like the humans that we are. We're learning something new. I'm teaching you something new. And this is the importance of why this is important to learn. And at the end of the day, the learner and yourself, you have this sense of confidence because you just learned something that has made you even more autonomous and it's giving you the independence that we all want.
Okay, I will be the next. So yeah, the topic of the trust is I will separate the trust issue into two separate aspects. The trust between me and the learner, and the trust of the learners, how they trust about the technology or the tech digital literacy. So for the first aspect, I would say when I when I call my learners in the very first time, they don't even know what is CDN or community tech network. And because especially for the Chinese one, they don't know even the English wording. So I have to use a lot of time to explain to them. I'm calling for helping them, and I will not charge them for any money, or I don't even need them any personal information. I have to persuade them use a lot of time to at least let me to introduce myself and start my work for teaching them how to use the device at the very beginning. So normally, because when they heard that, oh, this a free service, and they don't need to give me any information, they will feel like more comfortable with that. And that's the first step of building the trust between me and the learners. And after that, I believe this is very important for as a trainer. We have to well equip ourselves for every aspect of the training materials. Because when we show that we are so professional and we are so patient to help the learners, they will feel that they will they know we can solve their problem in any aspect, even though they didn't uh, uh, they do not use any digital device before. But when you talk to them in a very good manner, a like I don't talk with them very fast, and I will keep my voice up, and then they will show that I am respecting them, and then they will start to listen to what I'm going to teach them. And after that, so I how to build their trust to the digital device. Yeah, because most of the aging population, they don't even know how to connect to the internet at their home. And they may think that, oh, if I sharing the internet, maybe my personal information will be stolen by someone. Or they sometimes they may always meet many scammer around. So I would say I will let them trust the device by step by step, even though a very small step, like because when they use the device, they have to know how to set up their language keyboard, and maybe after that they can know how to use some very interesting apps like YouTube. So even though I know they may list the help for the healthcare, but I won't jump to healthcare immediately, because that may that may not I know that's practical, but I would like to start something interesting, and let them know, oh, they can familiar with the device. And after that, after they build a little bit confidence, and then I can go up to and other more advanced apps, like creating the email address, password, or even use some healthcare portal. So yeah, but I know it take a little bit long time to get them familiar or get used to that device. But all the process of trust needs some time. So yeah, that's my sharing. Thank you.
One of the
Yeah,
ways
and
to
then to
gain,
add,
oh,
sorry, go
sorry.
ahead.
Because I saw Isaac posted something about how to navigate teaching people things that you don't even know, or you don't know too well yourself. And that's a really good example of how to build trust. Just be honest with people, because a lot of your students are going to look at you like you know everything about this computer. You know how to turn it on, you know how to build it from scratch. But that's not true. I mean, be upfront, be honest, let them know, hey, I'm learning this too. Let's learn it together. Let's figure it out as a team. And that's one way that you can help people learn even more, is having them work with their peers. If they're in a larger classroom setting, where it can be like, hey, you know, Doña Maria over there already knows how to log into her email. Maybe she can show us how to do it, because it builds that comfort. Um, One other thing too is working with organizations that are already established in your community, or in the specific community or population you want to work with. So that way you can get in there and you can say, hey, I know how to do these things. Your your community needs this help. Let's work together to see if we can get it done together. That way you don't have to worry about spending too much time building that trust, because you would have somebody that they already trust with you, helping you navigate that space.
Pat, I want to get to what you're saying. I'm going to piggyback a bit off of what Ethan said in response to Isaac, because Isaac, I think that's one of the key questions that's always going to be, it's always going to be relevant, because there are always going to be technological advances. As soon as you learn one healthcare portal, they're going to upgrade to another healthcare portal, right? And I think that this question is very important. And I want to piggyback off of what Ethan is saying from the perspective of how to be an effective teacher. And one of the best ways to be an effective teacher is to show that you don't know, because this, when you demonstrate that, as Ethan said, either to have peer-to-peer learning from someone who knows, but also as an instructor or in a setting with a digital navigator to say, you know what, actually, I don't know, let's try this. The learner is learning multiple things. They're learning that, as Ethan said, nobody is truly an expert on, they're not sitting with the person who built the computer. And that's important. They're learning that they're not going to break anything. Because when they watch you try to figure something out, the computer's not exploding, nobody's hacked into your banking account, the sky hasn't fallen. And that's an important thing for them to learn, is that as they watch you do stuff and it's like, oh, that doesn't work, I'm going to undo. Oh, no, that's not what I thought. We need to refine this. They learn resiliency, and it demystifies new situations. And what happens to the learner is they think, well, I could be in a situation where I don't know everything, and I could sort of play around and try to figure it out. And if I feel like I'm in over my head, I can just get right back out, and I haven't caused any danger. And I think that that's a very important lesson to learn, because the great question that you just asked is a great question for today. And as soon as we feel like we master that, tomorrow there are going to be new things that we don't know. And it's always great for the instructor or the digital navigator to know, like, you know what, I don't know, and this is what we're going to do. You ask a great question, we need to learn new things, let's do that. Pat, I'd like to turn it over to what you were going to say.
Yeah, where to start? So for the trust question, some of the things that I've seen as a volunteer volunteer coordinator, and helping with the volunteers and doing some of that work myself, we ran into trust issues with our participants because they don't remember who we are. So one of the things that we worked on was like trying to figure out what our participants remember about like the services that have been provided or our partners provided, to get the participants familiar with why we're calling them. Once we hit that point, then they're like, oh yeah, okay, yeah. And then like the conversation switches, and it goes from being kind of in a protective mode to like having conversations about their family. So it's really about finding that common ground with them to build that trust. As far as Isaac's question about dealing with the evolution of technology, it goes along with like what Ethan and Becca said, that we don't know everything. And one of the things that we talk about with our volunteers is like, what do you do when a question is asked and you don't know the answer? Many of our volunteers say, well, I straight up say, I don't know, and I will investigate and get back to you. And we also recommend to them, if it's possible for them to investigate while they're working with a learner, that's even better, because then the learner can see what the navigator is doing and hopefully maybe learn a strategy of investigating how technology works, what the new technology to them, how it works, or new technology in general. And then, for our perspective, we're always coming up with ideas of like knowledge that we can share with our participants, like creating new webinar subjects, putting that in our tech advice drop-in sessions to talk about with the group. So we do what we can to cover as much information as possible, which is also why I think we are saying now, like having these tech advice drop-ins is very important after we finish up our training curriculum, our set training curriculum, having a space for people to come back and talk to us and ask questions if questions arise.
What is a tech advice drop-in and how does that work?
Yeah, well, we started calling it Q&A sessions. So anyone can come in and ask any questions that come up as far as technology. It could be something related to their device, could be something related to the internet. There was one question in one of the sessions where someone was asking our volunteer coach for that session about how they can go and find some long distance relatives because their relative that's like geographically close to them was having health issues and she needed to contact his relatives who are not living close by. And so she had no information on them. They tried it during the session, didn't find anything, and then the coach went off on his own and found their relatives, and she was able to connect with them. So, any question like that, we will help as much as we can.
And if you want to talk about building trust, I mean, in a situation like that, that's golden. This does bring up, and please, if you have other questions or comments, please do put those in the chat because we do have time to address those. But I don't want to skip over one other thing. Patrick, from an organizational standpoint, representing an organization that is liable for its employees, Pat, same as a volunteer coordinator, but also for navigators here. If we're helping people with their health questions, if we're helping people contact their doctor or make appointments or look in their health portals, this is private information. This is secure, confidential information that is important to them. It's so important that they can access, and yet we have a person with them who is now seeing their private information. Can you please address both organizationally and policy-wise, but also just advice-wise to navigators, how to handle private information?
Yeah, let me start first. For our teaching staff, because when they go for onboarding process, they will receive some privacy and privacy training. They will have to pass the test for the privacy training, and of course after that, I will talk to them and let them know the importance to keep our learners' information privacy because even though in our system we can reach out the document which consists a lot of learners' personal information, and we have to make sure that all of those information are confidential and they cannot share or use them for other place. And then after that, because when if the instructor has to help our learners to for example how to use the healthcare portal, we for in person it may be better because we can just teach them side by side and ask them to input their information personally. We of course we don't input for them, and we don't even write their information down. But for the virtual setting, because especially for the pandemic period, we can only help them through the phone or even in the Zoom meeting. So what we can do is that we have to ask them to we use some software like Zoom or any desk and ask them to share their screen from their device. And then we, through the phone or in the Zoom meeting, we just ask them to go to click on what app or how to download the app, and then they input their information by themselves. This is what I request our instructor to do so. Yeah, because I know it may be it may faster if we can input all the information or create the email account for them, and then they can just log in. It is very fast, but that is not the measure to protect their information, because and then maybe they may not feel safe about that, because we got their all the password or username, and also the very sensitive healthcare information in the maybe some health report in the apps. So that's why I will make sure our instructor will let the learners do by themselves. This is the principal means I would like to say. Yeah.
Yeah, and then to add to Patrick, I think, I don't know if the instructors are advised to do this, but for volunteers, we do talk to them about the privacy, and when they're video sharing, we actually advise them to let the learners know once they get to a place of putting in sensitive information to turn off this video sharing, so that the coach, the volunteer coach, does not see that information either. I have run into working with a learner myself where they were like, "Oh, I don't care if I share my information." I'm like, "No, this is our policy. For you please turn off your video sharing, and then let me know when you're done, and then we can share again." We're pretty like, our recommendation is pretty strong about that, to make sure that they don't see that privacy information. And so that's what our practice is.
Major concern that I've worked with in the past is people don't have a device of their own, so they use community devices and shared devices, or even their community health workers' device to try and to do these things. So it's important to know, as a navigator and somebody that's helping with helping people on their own device, is to make sure that, one, you're very upfront with people. You let them put everything in on their own. If you have to, you wipe your device, you show them you're deleting cookies, browser history, cache, all of those things when they're finished. Because in the fields that I've worked in, people can't afford their own device. So we have no choice but to say, "Hey, here is this tablet that's, here on the table, that's giving information. Let me help you sign up for the free COVID tests." Turning off the autofill option, because you have to put your mailing address. Making sure that you're using a private incognito mode that doesn't save anything on there, to help ease some of that stress. Because it's really important to just make sure that you're safe, because you don't want to be liable if something were to happen, knock on wood. And you want to make sure that the student is also safe, because you don't want them going out willy-nilly giving out everyone, "My email is, johnsmith@gmail.com, and my password is password1 with $ instead of S. And here's my doctor's account, my doctor's office info." It's really hard to stay in that lane, but it's something that's really necessary, and you have to take those extra steps just to prove that you've deleted all of their information.
Yeah, and I could just quickly add, I think in the spaces that I've worked in, I've they're mostly me training learners how to use devices that we either provide to them or they bring them themselves. So having to use it off of my own personal phone hasn't been something I've had to do, thankfully, because God knows that like I open my phone and it's like how to spell the most easiest word is my last search, and it's like really embarrassing that I can't spell the word mischievous or whatever. I can't spell it. But something that I think anyone would feel comfortable knowing, whatever spectrum of technology or age that you might know or are, is just explaining what private information is and how to protect yourself. So explaining them like what data sensitivity is. So like not sharing your social security or your medical data, your passwords, and why that it's important to protect it. Teaching them about strong passwords and making sure that they know how to change their passwords in case they either feel like they overshared it with maybe like a family member who they don't want to share it with anymore, or they wrote it down and lost their little notebook where they have all their passwords, making sure they know that they can go and change that password. And then teaching them something that's new to a lot of us too, because I learned this maybe like 5 years ago, and I'm still not using it on all my apps, but I should. But the two-factor authentication or a password protector, and then just showing them how that works, on how, hey, no one's going to log into your computer unless they have your phone on them. So make sure you have your phone on you so you can log into your email or your computer. And then beyond that is just helping them recognize those little tips on how to recognize scams and phishing, or showing them how Google Chrome will tell you if the website is secure or not, sharing those safe practices on not answering scam text messages or opening those emails that look weary. And then, of course, telling them that their health portals have very important and private information, and how that is something that to keep to themselves and to people that they trust. Um, those are some things that I know have helped my clients feel way more at ease when talking about cybersecurity or having an online presence, and making sure that we're able to simplify that concept and have them practice logging out, logging in, remembering their passwords, and reinforcing security habits like logging out of your email on public computers, or turning off your computer fully in case you just decide to just leave it sitting there in the public workroom or whatever it may be. But those are all different tips and reminders that I make sure my learners know.
That's great. We're getting towards the end of time, but we're not out of time. Before I ask a final question, just to your point about spelling, Ale, for most of us here on the call, I've been a professor most of my working life until recently, and I taught writing. And again, with the like not being able to multitask, a lot of times I'm teaching and I'm talking, and when I turn to write on the board, who knows what's going to happen. But speaking of spelling, I was making a joke and I was trying to say bougie, like, oh my God, that's so bougie. And I spelled it boogie. And it's just, so I hear you. But one I would appreciate a final thought from each of you, and I'll give you a choice. The first question is, based on a lot of the information in the chat, everyone is recognizing that a lot of this digital navigator work is on a public device, in a public space. There are these privacy concerns, which we've covered. But one aspect of that I would like to cover, so here's choice number one that you can respond to, is occasionally, I would imagine this puts the digital navigator in a weird position where if they can see the screen, right? Like if they are in this position where they are looking at things, or if their client is asking them things or confiding things in them that may not make them feel comfortable. And this goes beyond privacy. This is more the comfort level of the navigator. Can you respond to tips and strategies about that? And or could you offer us sort of your final thought, or like one thing that you haven't been able to say about anything that we've talked about today? I'd love to give each of you space for one more comment before we finish up with our raffle giveaway.
So I can talk about something that's like related to survey questions, because all of us do survey questions to get more information. A couple of things, like survey questions to the participants, they don't feel comfortable answering them. So some of the ways that we've tried to address the comfort of answering these questions is letting them know how much we're putting privacy on their information, trying to lock it down just for our internal uses, and then also explaining to them the reason why we are asking this information, because the reason why we're asking for this information is to improve upon the services that we're providing. More focused information on what they're doing and what they know, and where they're at helps us meet them where they're at. And then on the other side of like navigators, volunteers, there has been an instance that I had to address with a navigator, saying that they weren't comfortable with the questions that they were tasked to ask. And admittedly, they did sound kind of very personal. But again, they were questions to help us understand where our participants are coming from, so that we can understand where we need to meet them. And so what we did was just have a conversation with the navigator, with the coach, to hear their concerns, explain to them where we're coming from, and see if like we can come to an understanding. And so the majority of the time we were able to address the concerns that way.
With something that Pat just said, if I can guess, and correct me if I'm wrong, I feel like I had that experience that those navigators might have had with my aging adults working at the clinics or at the housing authorities. So some of the questions that we would ask, which is very normal for grant purposes and data purposes, is, name, last name, address, gender, sexuality, race and ethnicity, and like unemployment status. So there was just all these questions that my organization had me ask them. And so the options, there's different options that they just weren't comfortable hearing. So like I had these aging or learners who were just like, what does that mean? Like, never heard of LGBTQ. Like, I don't know what you mean by this word, or I don't know what is heterosexual. Like, they were just very uncomfortable with these terms that, to me, I'm just like, well, it just means that, this or that, or like that I'm queer or that I'm not queer. And but all of these words were uncomfortable for some of these learners. And it may be because they come from a time where that wasn't something that was like more generally spoken about, wasn't something that people were comfortable sharing about themselves or hearing about others. And so having those conversations was something that I had to sit back and think, oh, okay, like I have to explain this in a very cultural, respectful way, where I am valuing my values and also respecting their view, but sharing the importance of why I'm gathering this data from them. And that, to me, just kind of goes back to what I originally wanted to share, was something that I think is very important that we always keep in mind, is just being patient. And something that I always have in the back of my head is when my mom told me once, like, yo te enseñé cómo usar un tenedor. Like, I taught you how to use a fork. whenever I would complain about her asking me over and over again how to like turn on Netflix or what her Facebook password was, or she needed to get into her utilities portal to pay the utilities but couldn't remember her email and they were about to cut the utilities, and I was like, why did you get to this point? And so when she told me like, I taught you how to use a fork, I was like, you also taught me how to use a restroom and how to eat and sleep and talk. And now I'm extremely embarrassed and I feel extreme shame and guilt, making her feel like she couldn't learn something new from me. So, anyways, having patience and approaching your learners the way you would approach people that you love, because that's just how we should treat humans and animals too.
For me, I just want to share my story with my learners. Yeah, that's it. Because for my first, I remember my first learner is I teach her since 2020, and at that moment she even didn't know what is email, and even how to don't know how to set up password. But after a pretty long time, because our CTN has a Q&A which Becca mentioned before, and we have the Chinese Q&A every week, and she joined every week after. And for now, she is asking me how to use ChatGPT, how to edit the video through iMovie, and she is already 80 years old. So that which means if we can um, build up their interest in using the device, and then we can keep we have a ongoing program which may let them learn different things. They can just learn like us. We can learn, have a lifelong learning. Yeah.
Build the relationship, keep the relationship. People want connection. Aging populations want that connection and that conversation. A lot of the time, they're going to talk to you about their life story, about how their spouse passed away and that they were married for 60 years, living in the same house, and now they have all these problems. And you're going to get your ear talked off. But it's okay. Listen, you'll learn something new from them, and they'll learn something new from you at the end of the day. One of the big issues with questions, and I'll try and be real quick, is people are afraid that you're going to report their information to the government and they're going to be at risk of being deported. You got to be really upfront and be honest and say this has nothing to do with your legal status. That makes no difference to like how Pat said on the chat. It will not impact how we work with you and teach you, because we are here to help you navigate the system better. And if you learn how to use the technology to do it, we can help you figure out how to get to that questionnaire and those forms that you need to fill out, so that way we can help you feel comfortable and become a resident or a citizen in your own time. And also send them to those other resources and let them help them find those other resources. So I know we're over, so I'm going to stop talking now.
I honestly can't think of a better way to end that than in the spirit of truly helping people at the heart of things, developing connections, developing rapport, and also both in the chat and as you've mentioned here, a lifetime of intellectual curiosity, lifelong learners. That's what everybody on this call is. And that's the spirit we're trying to enforce in others. I thank you all for sticking with us. Please hang with me for 3 seconds while we give away some, speaking of lifelong learning, while we give away some courses. Before I explain the last course, I do want to thank you so much for being with us throughout all of our webinars today. And I do want you to save the date, November 21st. Save the date, because guess what? That's going to be all about caregivers and digital skills. So it's very relevant actually to part of this conversation considering that both health equity and aging populations oftentimes involve some type of caregiver. So please, November 21st is going to be all about caregivers. And now, just in closing, just 3 more seconds, please. I'd like to tell you about the course that we're giving away today. Appropriately, we have an online, very robust asynchronous course that you can take at your own pace. It's a $300 value, and it's digital equity and the aging. It talks about several components that we hit on today. What devices to use, not that you always have a choice, of course, but what tips to use that are most effective for accessibility for aging populations, tackling a lot of stereotypes. I touched on this in the beginning. Oftentimes, aging populations were actually the foundation of literally all the technological knowledge that we have now. So battling stereotypes, developing respect, meeting the learner where they are, how to teach adults, and some specific pedagogical skills about how to relate concepts to connections that they may already have, and how to teach via listening. A lot of what Ethan said of like, they're going to do maybe they're going to do a lot of talking. And if you can respond and integrate your points into what they're already invested in, it's quite effective. Before I do the giveaway, please know that you can reach our team and any of these speakers if you will just email us at lift@communitytechnetwork.org. If you email us any thoughts about this or any other final thoughts, we will happily get back to you. So here, without further ado, is our random giveaway for digital equity and the aging. Do we have Alma Adams?
I'm here.
Alma, I'm going to follow up with an email to you with more information about your enrollment. Congratulations.
Thank you.
Do we have Sandy Liu?
Here.
Sandy, I recognize your name and am happy to enroll you as well. Lastly, and please excuse my pronunciation, do we have Tony Cirlos? Tony Kurlos? What about Sarah Friedman?
Hey, I'm here.
Okay.
Yay.
Congratulations to all. Again, thank you all for your participation. We wish you the absolute best end to your Digital Inclusion Week. Thank you, Lord, that tomorrow is Friday. And thank you for joining us, everyone, so much. Thank you for our panelists, too.
Lift team, can you stay on for just a quick